I grew up around just kind of sports and medicine. My mom was a personal trainer. And so, I grew up and I had a knack for anatomy and physiology, and I also played sports myself. So there was sort of this natural inclination towards musculoskeletal medicine. Some people come to us because they explicitly want to try and optimize a lot of the non-pharmacologic and non-operative approaches to managing their pain. And so we recognize, there's a time and a place for medicine, for surgery, for injections, but some people either aren't at the point where they want to pursue those things, or they just simply want to try these things first. And so, how I generally approach it is when a patient comes in, we want to do a short trial of care to establish if they respond to care, because there's a lot of people who do, but some people don't. I want to start out just to hear someone's story, to understand, how long have they been experiencing this and what type of impact has it had on their lives. I want to get a good background and understand what makes this better, what makes it worse. And then going from there, I focus immediately on self-management. So my goal is ultimately to help encourage someone to manage this as best they can on their own. So we talk about things that they can do at home as far as exercises, stretches, different heating, or other modalities that might be helpful just for managing some of the complaints. One of my goals is really to help be your quarterback, especially when it comes to back and neck pain. So I'm not going to work as a siloed off practitioner from the rest of your medical team. It's important that we work as a team to collaborate, right? And trying to manage this condition as best as possible. So let's say we get to the end of that initial trial of care and say you haven't responded either as much as we would like or just haven't responded at all. Then my goal is to help coordinate and facilitate some of those referrals, discussing what are your other options. I've always loved patient stories. Just getting to experience their different personalities and getting to interact with them on a regular basis. So as a chiropractor, it's a bit of a unique opportunity to get to see someone on a regular basis. And so we have not only the treatment that we're doing, the hands-on stuff, but we're also just building that relationship, which I think is important in the healing environment in general.